As a therapist, I need a new approach when it comes to helping people who are struggling with depression. In this video, we're interviewing Naveen Thomas, MD, and we're going to talk about two things. First, why ketamine helps with depression. Second, we're going to talk about a different approach using ketamine combined with psychotherapy. And lastly, make sure you stick around to the end of the video if you're struggling, because Dr. Thomas has a really special message for you. Today, we're meeting with Dr. Naveen Thomas, founder of Clarity Integrative Psychiatry here in Boulder, Colorado. He is a provider and facilitator of Ketamine-Assisted Psychotherapy. His training includes Emory University School of Medicine and psychiatric training from the University of North Carolina, Chapel Hill, certification through the Ketamine Training Center, and an integrative medicine fellowship from the University of Arizona, headed by Dr. Andrew Weil.
So let's say somebody is in a depressive state and they're seeing the world with smoke-colored glasses. Everything looks dark to them. Maybe another person seeing life through a rose-colored glasses and everything looks wonderful and beautiful and loving. The depressed person doesn't usually have access to that.
Why doesn't someone who is experiencing depression have access to that? There are many reasons. Yet one of the findings in the latest brain research is the discovery of a very specific network in our brain called the default mode network, which involves part of the brain when we're not focused on a specific task. Daydreaming, for example. So it's highly active when we are thinking about our internal narrative, which is the story of ourself that we tell ourselves.
The reality is many of the people who come, at least to my doorstep, to seek healing, a lot of times they're coming because that narrative has become fixed. And it's often negative. And it's not necessarily serving their highest growth and transformation. People may have thoughts like, I'm no good, what's the point? I've failed so many times, why should I even try?
Those are some typical negative narratives. As a therapist, it's so hard to see someone who is trying their very best to heal, yet these negative narratives are really creating so much pain in their life.
Ketamine can temporarily disrupt, pattern interrupt, blow it open, even temporarily, and to allow people in that period of time the opportunity to witness something bigger. And I don't want to use overly mystical language, but something bigger than what they normally conceive of as their self and their story. And sometimes just that little experience can give someone so much hope. Yes, we're capitalizing on the chemical antidepressants and anxiety-reducing effects of the medication, but we're really kind of using that non-ordinary state of a consciousness, what I call an expanded state, as a primary healing modality.
Primary healing modality. This bears repeating. What Dr. Thomas is saying is, yes, of course, ketamine as a molecule is a very powerful antidepressant. But the exciting innovation is for the providers to create a warm, comfortable, and safe therapy room in our office space that allows for a person to go deep within to heal with a trusted therapist by their side. This is called Ketamine-Assisted Psychotherapy, supporting you throughout the entire process from beginning, middle, to the end and beyond, which includes integrating the experience to help you make changes in your life.
In the Ketamine-Assisted Psychotherapy model, a transformational model, we really want to allow the person to experience that non-ordinary state, that expanded state, so they can have tremendous learning. They can have tremendous insights into their life that wasn't maybe available to them earlier, feel a tremendous sense of connection to the people that are important to them, to the things that are important to them, the priorities that are important to them, to the communities that are important to them, a tremendous even unlearning of dysfunctional patterns of behavior. And it can happen in a flash. People can have that aha moment, like, oh my gosh. Learning is critical because in that model, when the person learns, hopefully with some training and proper integration, they can take that learning and they can apply it to their life. quite honestly, the whole point of the therapy, as far as I understand it, is so that it's not necessary in the long term. Give the person enough healing experiences of their own power and their own sovereignty, that they don't need the medicine. I mean, how cool would that be? We make ourselves obsolete. Don't give up. Don't ever give up. Even if you think all hope is lost, find somebody in your life who can help you see another perspective, and someone who can help, cares enough to help you get the help you need. Because I'm convinced that we all can heal, and just don't take no for an answer when it comes to your own healing.
To learn more about Dr. Thomas's Clarity Integrative Psychiatry and my therapy private practice called Inclusion Recovery, please click the links in the description below.